Hello Rainbow Hospital, my name is Ishita. I am here to talk to you about my pregnancy journey so far. Pregnancy as a feeling for women is always very special. You get to birth a new life. It is a whole new experience altogether, and things seem to be very happy and smooth flowing at the initial stages. But for me, this pregnancy is all the more very close to my heart because I have experienced a few complications. There were times when we as a family, my husband and I as a couple, we were very down in terms of our emotions and feelings because of how the complications were spanning out. But thankfully, I would say Rainbow Hospitals, especially the staff here, Dr. Chetan, who has been attending to me non-stop, have been so cooperative. They have been a blessing truly in my life, and I think I couldn't have asked for a better support system during this whole phase that I've been through. To mention some certain things very significantly, I had to get admitted in the hospital for about close to 2 months. I stayed here. So the staff here, the doctors have been also cooperative. Especially during my difficult phases, there were times when I really needed a lot of urgent attention, and that is where Rainbow as a hospital, as an organization, stepped up. They have been very proactive in terms of identifying my symptoms, in terms of recommending blood tests to me, giving me medication on proper time. And I think, personally speaking, Dr. Chetan is one of the biggest blessings that I've ever had in my life. She is so prompt. She is a person who is able to foresee what can happen in the future, and that is exactly how she has done my treatments, be it a scan, be it a blood test, be it any kind of other reports, other checks that she had to do. She has prescribed me with medication well in advance so that my condition can get stabilized. And altogether, I think my husband and I have felt very blessed in terms of people coming around and helping us. Small little things that really matter to you as a patient has always been taken care of. One or two examples I can quote is, every time a nurse came to prick me and they wanted to take blood, they have been very polite and they have told me sorry like 5 times before just giving me a prick. That was not needed. They are simply doing their job, but those are certain things which really affect you and make you feel good as a patient.
Hi, I am Dr. Chaitanya Relivigi, consultant obstetrician from Rainbow Children's Hospital, Banegata Road, Bengaluru. I would like to tell you a fairy story about my patient, Ishita Kapil Lahari. The moral of the story is trust or faith. I met them 9 months back in my OPD when they were 2 months pregnant. I realized it's a high-risk pregnancy in view of her age and in view of her married life. I said God should take care of this couple well. At 4th month of pregnancy, the scan showed cervix was open with a funneling of the cervix. So we put an emergency cervical stitch, and as usual, we put them on the medications and rest. At 5th month stitch, again in spite of stitch, the cervix had opened some more, so we had to put an emergency pessary along with complete bed rest and some more medications. For my bad luck, as she was under rest and it was a pregnancy, sugars were increasing. Fortunately, with the help of physicians, sugars were under control, even though in between sugars were fluctuating. At around 27th week, she started complaining of itching, wherein the LFTs were extremely abnormal. We have put her on medicines for that, took opinion from the physicians and the gastroenterologist. Our plan was to deliver this baby because they were extremely abnormal. We thought we'll admit her and give her a Maxilf and Betnazol. For our good luck, after 2 days or 3 days, the LFTs were less. We thought, why not we take chance and continue the conservative management. Patient was lucky enough, the LFTs started decreasing, but she decided to stay in the hospital. She continued monitoring her sugars. We had put her on injections, low molecular heparin injections, insulin injections. Husband was taking care of her. Sisters were taking care of her round the clock. It was like a family for her. They had lot of faith. They said, doctor, we are going to deliver only at 36 weeks or 40 weeks. We know it. So they were having a positive attitude. Any test we were ordering, without a second thought, they were doing it. Any treatment we were ordering, they were taking it. With this, 31 weeks, she celebrated New Year in the hospital. She went home happily on a wheelchair. The same treatment continued, monitoring continued. The LFTs were increasing again. So we thought enough is enough. Let us deliver this child. At 36th week, the scan showed 3 kgs with a good BPP. So they fixed a good day and good time. The whole hospital was waiting. The neonatologist, the senior anesthetists were there in the OT. With their help, without any problem, a girl or a baby was delivered on 6th of January with a 3 kgs with a very good upcar. Baby never went to NICU. Mother and baby were discharged on 3rd post-operative day with a smiling face and walking. So I thank Ishita and Kapil for their cooperation and trust with us.